All right, still no containment for the Ebola outbreak in Africa. It's now expanding at an alarming rate, and Africa's CDC says it needs more resources and more money, or the situation may get even worse. Reporter Jeff Paul has more.
The Ebola outbreak in Africa is on pace to become the worst on record. There have been more than 900 confirmed cases and over 200 deaths as doctors scramble to get containment. Now, African health officials say ongoing conflicts are heating up again in the Democratic Republic of Congo, stopping them from strengthening their efforts in those areas.
Our worry was delaying of having a humanitarian corridor and access. We'll be surprised with maybe surge of cases happening in this area.
Among the dead, at least 17 healthcare workers, as Africa's CDC continues pleading for more funding to buy protective equipment. Still, most doctors say they'll remain on the front lines.
Some patients can be aggressive. We have to be careful to pay attention to what they want. There are patients who don't cooperate, and we have to accept them as they are.
Hospitals across the region are now strengthening their containment protocols after the World Health Organization reported thousands of untraced Ebola contacts.
Since right now Ebola is an outbreak, the first thing we think about before we think about other things is to get that person, isolate them, and contact the surveillance team.
But that push for containment could also be keeping sick patients away from hospitals.
If you feel sick and go to the hospital, they say it's Ebola, and they put you in quarantine right away. That's what scares people.
America's CDC says there could be up to 50,000 Ebola contacts that haven't been traced or tested.